Okay. Welcome everyone to our webinar this afternoon. Our presenter is Kevin Kennedy, and he's with SALA, the Small Association Leadership Alliance, and he's here today to talk to us about his healthcare program. Kevin, it's all yours.
Great. Thanks, Sarah. Welcome, everyone. The webinar should last maybe about 20-25 minutes or so. And the program itself is really our effort to simplify just the ever increasingly complex healthcare that we have. That third bullet down has gotten a lot of attention over the last couple of weeks. And that's actually as of 2017, the Kaiser Family Foundation reported that 43% of small businesses at that time offered healthcare. We imagine certainly with the last year that has decreased, if not before. On average, folks are able to realize a savings of right around 60% compared to what you'd pay for traditional insurance on the state exchanges. And then lastly, every year we survey participants in the program, and our last survey showed 91% of participants were either very or extremely satisfied with the program. So it's certainly been well received and well used. But what we are talking about today is an alternative approach to traditional health insurance. When folks first enroll, you first pick a plan from Apex Management. Those plans are really focused on your preventive care. In other words, everything that happens outside of the hospital. There are two options to choose from. I'll go through those details and pricing, of course, at the end of the program here. Once you pick the Apex plan that best fits you and your family, you would pair that with a membership to Sedera. Sedera's medical cost sharing, and I'll spend much of the next 15 minutes or so talking about Sedera and medical cost sharing, as it may be a new concept for some of you. Our healthcare and the program in general really falls into these three components, if you will. There are large costs, which we refer to as needs. Those are the significant medical events we all have at different times in our life. Could be surgery due to an accident, maybe a hospitalization, maybe just some diagnostic imaging while they're trying to figure out what's going on with you. But again, the significant medical events, and that's really where Sedera comes into play. Then there's a small to medium cost. That's more of the run-of-the-mill type stuff we all have throughout the year, a cold, a sinus infection, a flu. And then there's preventive care, which is everything from childhood immunizations to your annual physical to colonoscopies and mammograms, and really everything in between. So the program certainly covers all three of these components, and I'll refer back to this slide a couple times as I go through. But like I said, I'm going to spend much of the next 15 minutes or so talking about Sedera and medical cost sharing. Medical cost sharing originated back in the 1980s, and since then it's really had a foothold with religious groups. Different churches and religious organizations formed organizations through which their members and parishioners could share in each other's expenses. Sedera's parent company is called the Caris Group, and the Caris Group is a medical bill negotiating company. And they're the company that many of the religious organizations have used since the 80s or 90s to negotiate their larger bills. Well, when all of our healthcare costs started to increase and continue to increase at a rather alarming rate, the Caris Group formed Sedera. Sedera is built upon the same best practices as the religious organizations that I mentioned, but they don't have any religious affiliation or requirements at all. They're a non-religious organization. I think this slide illustrates really pretty well why we're all here, and I apologize for the fonts getting a little wonky on the bottom there. But as you can see, we call it the unsustainable squeeze. Over that 10-year period, on average, wages have increased by about 19%, as indicated there in the purple. Total premiums for insurance have increased by about 55%, as indicated there in the green. And then the employees' portion of those premiums have increased by about 70%. So it's a story we all know, which is simply that the cost of healthcare has increased and continues to increase at a rate that outpaces everything else, including our wages. I think as I go through the presentation, y'all will find that our objectives are really in line with your objectives. Enjoying the freedom to choose is something I'll talk about in the next couple of slides, and that's something that most Sedera members enjoy the most by being a Sedera member. Lowering monthly expenses is certainly something we're all looking to do. And then, of course, reducing our large medical costs and also our out-of-pocket costs. You'll find when I get to the pricing towards the end of the deck here that for everyone, it will save you money on your monthly costs. But for most of us, it will also save us money on our out-of-pocket costs. Medical cost sharing is unique. Every member is a cash paid patient, as you see up there on the top. That means that with Sedera, you do not get a card like you might have now with your insurance. You would simply tell the hospital or doctor's office that you're a cash paid patient. And I'll discuss that more in the next few slides. Down at the bottom there is what that means, though. Because you're a cash paid patient, you can enjoy freedom from networks. So Sedera members can go to any hospital they like or doctor they like to get the care that they need. They're network independent. And then on the top left there, sharing is on a per need basis. Rather than having an overarching calendar year deductible that you have to meet, sharing is handled on a per need basis with Sedera, and I'll refer back to that a couple more times. One more illustration here, I believe. This just shows the adoption rate of medical cost sharing over that 7-year period. You see by the end of 2017 there were more than 1 million members sharing more than $1 billion annually. That membership number now is closer to 1.5 million as the community continues to grow. But let's talk about Sedera, and let's talk about a need again. A need is it's the significant medical events that we have at different times in our life. So what is a need exactly? A need is one or more medical expense caused by a single accident or illness. So the member's responsibility financially is what's called the initial insurable amount, or IUA, that you see there. When you enroll, you have 5 levels to choose from: 500, 1,000, 1,500, 2,500, or 5,000. And again, that's what you're agreeing to be responsible for financially if and when you have to use your membership. So if we look at the illustration there on the left, that's someone who had a broken leg or a leg injury of some kind. So they would have the cost for the ride in the ambulance, surgery, the stay at the hospital, diagnostic imaging, prescriptions, and physical therapy, and all of these costs are wrapped up into that one need, whether they occur over a period of months or weeks or over a period of years. The member's responsibility for that need is that IUA, the initial insurable amount. So if we look at the broken leg scenario, let's say the total cost there were $10,000 and you had selected the $1,000 IUA, you'd be responsible for paying that first $1,000. The balance, the $9,000, would be shared through the community and paid accordingly. And I'll talk more about that sharing over the next couple of slides. At the bottom there, and again, I apologize for the fonts, if you enroll as an individual, you'd be responsible for the first 3 needs in the calendar year. If you enrolled as a family, you'd be responsible for the first 5. If you had a 4th or more as an individual or 6 more as a family, it'd be at a $0 IUA. So if you're looking to see what your maximum out of pocket might be or what your maximum financial exposure is, if you enroll as an individual, it's 3 times that IUA. If you enroll as a family, it's 5 times that IUA. So for example, in 2018, I enrolled with the $1,500 IUA. So my maximum exposure, if I had a pretty horrific year, would be 3 times that, or $4,500. Now, as a practical matter, we all hopefully have fewer than 3 needs in the calendar year, or fewer than 5 as a family. But again, it is good to know that if you had any more than that, it would be a $0 IUA. So at least you know your limit, if you will, financially. Here's a real quick real-life example. This actually comes from the CEO of Sedera. Prior to joining Sedera, he and his family had a young child with a persistent ear infection, and they were on traditional insurance, of course, with a $5,000 deductible. Their son, after a series of antibiotics and boosters, went to an ENT who inserted tubes into the child's ears. On the left, you can see the out-of-pocket cost of that procedure is around $2,525 with co-pays and then the cost of surgery. And on the right, of course, if the member had selected the $500 IUA, their out-of-pocket cost would have just been that $500. Now, the sharing works in a couple of ways. In a situation like this, where it's a scheduled surgery or a scheduled event, you would just call Sedera and say, our son's having this procedure done 2 weeks from tomorrow, whenever it is, and you have a need that will need to be shared with the community. Given the relatively small nature financially of the cost of this procedure, Sedera will probably not do anything more at that point, and just wait for the member to upload their bills. But let's say that the surgery was $250,000. If that was the case, Sedera, through their parent company, the CARES Group, may actually reach out, and probably would reach out to the facility and to the hospital and to the doctor's office and look to prepay for that surgery. And doing our own due diligence of the program, we spoke to a number of hospitals around the country, and they all gave us the same answer, which was if someone prepays for their surgery and pays cash, which essentially is what would happen here, they would discount the cost of that procedure 50%. On average, by using the parent company, the CARES Group, Sedera is able to save between 47 and 53%, depending on the procedure, over the cost of the surgery, simply by maintaining good practices here through their parent company. So that's the way surgery works if it's a scheduled event. Let's talk about if it was an emergency. Let's say it was the broken leg scenario. If that's the case, you go to the hospital, go to the doctor, get the care that you need. When you're done, you would reach out to Sedera and tell them what happened and that you have a need for sharing. Now, the member's responsibility in either scenario is to get the bills from the hospital, from the doctor, and upload them to Sedera. Sedera has an app where you can do it to their website. And you simply scan or take pictures of the invoices, and you upload them to Sedera. Sedera will then facilitate the sharing within the community. So in a situation like we have on our screen here, where the bills are $2,525, and this member had the $500 IUA, and about 3 weeks after submitting the documents, they would get a check for $2,025, and they would pay the balance of their bills. On average, those checks are released in about 3 weeks. Larger bills may go to 4 weeks. The nice thing about the way Sedera manages this is you have the same needs coordinator through the entire process. So it's the same person talking with you through the entire process, and they literally are speaking with you and your doctors and keeping you in the loop the whole way. When we do our annual survey, the needs coordinators that Sedera got among the highest remarks. They are a mix of customer service and finance experts all in one. They're pretty outstanding people. Now, there are some nuances to the program, as you might imagine. These next 3 slides really help indicate if the program is something that would work well for you and your family. This first slide, what it says there is when you enroll, members have to commit to a few things. The first is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices like diet and exercise can improve one's quality of life, but it also keeps us all healthy and keeps our medical costs down. Members also have to commit to not to use illegal narcotics and not to operate a vehicle while intoxicated. So what does that mean? That means if you're operating a vehicle while intoxicated and you got into an accident and you're hurt and you had medical bills associated with that, those bills would not be shareable with the community. The principle there is that the community should not have to pay for someone's illegal or reckless behavior. Now, other medical cost sharing entities have other restrictions. Like I mentioned, they're mostly religious groups, so they have religious requirements, and they limit other activities like skydiving and things of that nature. But what Sedera really comes down to using illegal narcotics and operating a vehicle while intoxicated. Also, tobacco users are certainly welcome to join. It's on the bottom there, but there is a $75 surcharge per month per household. So in other words, if you're a husband and wife who both smoke, it's $175 surcharge per month, not 2. Lastly, the fine print down there at the bottom, tobacco users over the age of 50 have a $25,000 per need sharing limit for the top 4 disease states associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. Medications. So there are really 2 types of medications we all take. Those that are curative and those that are maintenance. Curative medicines, like you see there, could be antibiotics or pain meds or chemotherapy drugs, but these are drugs we take for a period of time until we are cured. There's an end date at which point we stop taking those medicines. The costs for the curative medicines are shared through Sedera and part of that IUA math we just discussed with the broken leg and whatnot. The other type of medicines many of us take, myself included, are maintenance medicines. It could be for high blood pressure, high cholesterol, an overactive thyroid. I take them for rheumatoid arthritis, but these are medicines we take daily or weekly or however they are prescribed. And in my case, at least, will do so for probably the rest of my life. Now, there are plenty of actually, I apologize. If you're a Sedera member and it's a new diagnosis, let's say I joined Sedera in 2018. Let's say I was diagnosed this year with rheumatoid arthritis. If that was the case, for the first 120 days, the cost of my medicines would be shared through the community, just like a curative medicine. After that, it would be my responsibility. Now, I've had rheumatoid arthritis for many, many years, so it was a pre-existing condition when I joined Sedera. So I've actually been responsible for my maintenance medicine since I joined in 2018. Now, there are a host of great third parties out there, prescription discount programs like GoodRx or CleverRx, Liberty Benefits. I'm sure you all see plenty of discount programs on TV like I do. And I'll be honest with you, they have great discounts on drugs that are commonly prescribed and or in generic form. If you're on a high blood pressure medicine, a cholesterol medicine, something that's been around for a while and is now in generic form, oftentimes you can get them through these third parties at a lower rate than even your insurance, less than $10 per month. I get my medicine filled through the Apex program. If you recall, when I started the slide deck here, there are 2 components to the program, Apex and Sedera. The Apex program, the Advantage program, which we'll talk about next, towards the end of the slide deck, rather, they have a great prescription drug program. So I'm going to refer back to this slide when I get to their prescription drug program, and I'll talk about that in more detail. Pre-existing conditions. A pre-existing condition is defined as anything you've had a symptom of or received treatment for in the prior 36 months to enrolling. So when I enrolled, I disclosed, of course, I had rheumatoid arthritis. Now, on the Apex side, again, there's no relationship between Apex and Sedera, but on the Apex side, When I go to my rheumatologist, that's covered. I pay a $50 copay. Like I mentioned earlier, I get my prescriptions through the Apex component, and I'll talk about that when I get there. And then the blood work I get done a few times a year because of my condition, again, is a $50 copay. On the Sedera side, what they're saying is if that pre-existing condition leads to a need, if it leads to a medical event of some sort, that's when these restrictions would come into play. If it happens in the first year, there's no sharing for that restriction. The member's 100% responsible for those costs. In the second year, $15,000 would be shared. The balance would be the member's responsibility. The third year, up to $30,000 would be shared. Again, the balance is the member's responsibility. After that, it's fully shareable. So what we generally tell folks is that the program itself is a good option for probably 75 or 80% of us to consider, including those of us with pre-existing conditions, but it's not going to be the answer for everyone. Again, with my rheumatoid arthritis, it's a chronic condition. There's nothing on the horizon, if you will. I didn't need surgery or anything like that. So I joined without hesitation. But let's say back in 2018, when I joined that, let's say I was going through cancer treatment, or say we joined as a family and my wife was pregnant. If either one of those were the case, it would obviously not be the right time for us to consider this program because it would create a large financial burden for us in that first year, maybe even into the second year, which is exactly what we're all trying to avoid. We're trying to lower our costs. So by far, the most common questions we get from folks are on pre-existing conditions and how they are handled. Again, the ongoing care that I need with my condition is handled on the Apex side. This is talking about restrictions on the Sedera side with the larger medical events. At the end of the slide deck, you'll see our contact information. Please do reach out to us. I'm more than happy to talk with you, your staff, your family, whomever it might be, and make sure everyone understands exactly how these restrictions work and how they don't. The last thing, obviously, we want is for anyone to sign up and not understand how the restrictions work and all of a sudden be stuck with a large bill. So again, by far the most common question we get from folks is on pre-existing conditions, so please do reach out to us. We will be more than happy to discuss it with you. The second most common question, just so you all know, is on prescriptions. And when I get to the Apex component on prescriptions, I will discuss those in more detail. Now, included with everyone's membership is a subscription to Teladoc. Teladoc is the largest provider of telemedicine in the US. Telemedicine has certainly been in the news quite a bit this year with COVID, but even last year, more than 40% of our members used Teladoc. And the reason is it's a money saver and a time saver. And that's the exact same reason why 100% of Fortune 500 companies now offer telemedicine. It's a money saver and a time saver. For the patient or the user, it's a great money saver and time saver because instead of having to go to urgent care or go to see your primary care doctor or wherever you might go for a smaller medical event, you can connect with a doctor over the phone, a video call, or just a normal phone call. And they're available 24/7, 365. So if you're sick and you need a Z-Pack, or maybe you have an earache or an eye infection or any of those common issues that we have throughout the year, Teladoc is a great resource for you. Again, they're available 24/7, 365. So if you need to talk to a doctor at 2 o'clock in the morning because your kid's sick or you're sick, you can talk to a doctor at 2 o'clock in the morning and that doctor can prescribe medicine for you. So it's also a great money saver because there's no additional out-of-pocket costs for you. There's not a copay or anything else for you to worry about. And like I said, the subscription's built in, so there's zero out-of-pocket cost for folks in using it. And the Teladoc app itself on the App Store also has great reviews. It's really just an outstanding service. Also included is SecondMD. SecondMD is a great way to get a second opinion on anything you're going through medically speaking, of course, and from some nation's top doctors that practice at centers of excellence like the Mayo Clinic and Johns Hopkins and elsewhere. SecondMD is there for two reasons. One, there was a survey that showed the average physician was 13 years behind on his or her continuing education. So SecondMD makes sure we all have access to the most up-to-date information. It could be that there's a new medicine out. It could be there's a different procedure, something less invasive, things of that nature. SecondMD is also there because if you're having an elective surgery, Sedera requires you to get a second opinion, and you do that through SecondMD. Now, that opinion is not binding. You and your doctor make the decision on what's best for your healthcare. But again, they want to make sure we all have access to the most up-to-date information. And again, when we do our annual survey, the SecondMD folks, they also get just very high marks. They're really outstanding people. But that's it for the Sedera component of the program. Again, Sedera is really focused on those large costs or needs, as we call them, surgery or hospitalization or significant medical events. They also have the ancillary services like Teladoc and SecondMD that help with the small to medium costs. But now I'm going to switch gears and talk about Apex. Again, the Apex plans are really focused on preventive care, but they also have some services for ongoing care that I'll discuss as well. And there are two options to choose from with Apex. The first is your basic option that you see here. It covers all your preventive care items 100%. If you all recall back to when the Affordable Care Act was passed, it mandated that we all have certain preventive care services covered, 21 for adults, 28 for women, 31 for children. These are all covered. Even though the IRS penalties have gone away for people not carrying adequate coverage, certain states have implemented those penalties. Other states are considering implementing those penalties. The point here being that both Apex plans meet the federal and state requirements for preventive care, so no one has to worry about any of those penalties. Now, with the basic plan, it is just that, it's basic. There's nothing else included with the basic plan outside of your preventive care, with the exception of a health savings account. An HSA, as you may or may not know, is a great way to put away tax-free dollars to be used down the road towards any future qualified medical expense, such as dental, vision, prescription, or doctor visits. The HSA limits for 2020 was $3,550 for individuals, $7,100 for families, and $1,000 for those over 55. To be honest with all of you, if I did not have rheumatoid arthritis and did not need an additional level of care, I would be on the basic plan and take advantage of the HSA. I think it's a great vehicle to use. But I do have rheumatoid arthritis, and I do have some ongoing care needs. So I'm on the Advantage plan. Again, the Advantage plan also covers all your preventive care items 100%, but then has a copayment structure for any ongoing care. So if you go to your primary care doctor, it's a $20 copay. If you go to a specialist, like I go to my rheumatologist, it's a $50 copay. Any lab or imaging work is a $50 copay as well. And then this has the prescription drug program that I mentioned. As you see there, you have tier 1 and 2 generics, tier 3 preferred brand names, and then tiers 4, 5, and 6. If you recall back to that slide I had when I was discussing Sedera that had curative medicines on the left and maintenance medicines on the right, generally speaking, your maintenance medicines are in tiers 1, 2, and 3. The medicine I take for my rheumatoid arthritis, for example, one's a tier 1, the other's a tier 3. I also made sure to note that the most questions we get from folks, or the second most common question we get from folks, is about their prescription drug coverage. If you're on any prescriptions, we can look up the prescriptions you're on, make sure that it's covered, tell you what the cost is, and even tell you what the cost would be at pharmacies local to your zip code. So again, towards the end of the slide deck, you'll see our contact information. If you have questions about pre-existing conditions or prescriptions or anything about the program, please do reach out to us. We're more than happy to talk with you about it. Now, generally speaking, I said your maintenance medicines are in tiers 1, 2, and 3, and your curative medicines are generally in tiers 4, 5, and 6, and would be shared through Sedera. There are exceptions to that, of course. The only one we've actually come across was a woman whose husband suffered from seizures, and just the nature of the medicine he had to take was more expensive in nature, and so they actually did have to use a third party. But like I said, for most of us, our maintenance medicines are in tiers 1, 2, and 3, and the program sets up really quite well for that. And like I said, we can certainly look them up. Now, when I talk about Sedera medical cost sharing, I made sure to note that they're network independent. There's a freedom from networks. You can go to any hospital you like or doctor you like to get the care that you need. On the Apex component of the program, they do use a network, and it's the multi-plan network. The multi-plan network is actually the largest network in the US. There are more than 900,000 doctors participating in the network and tens of thousands of facilities, and it's used by thousands of healthcare programs just like ours. So it's truly the best network we could have partnered with. On the United Appliance Services website, there are directions on how to search the network. It's about halfway down on the Apex component section. Feel free to check out, or like I said, just reach out to us. It's a massive network. So just if you're living in a highly populated area, you will literally get results of thousands of doctors. So just so you're aware when you query the network. Also, one thing to note: some doctors are registered with the network by the practice name, others by the doctor name. So oftentimes we tell folks it's best to just run a complete directory so you can see everyone. But let's talk pricing. What's important to note actually is that we're all paying the same amount regardless of our sex and regardless of where we live. All the pricing is the same. This first slide is obviously for Apex. On the left, of course, if you enroll as a member only or individual, or you and your spouse, or you and just the kids, or you and the entire family, meaning spouse and children. That second column there is the basic plan. Starts at $71 and goes to $102. Again, the basic plan covers all your preventive care 100%, but that's really it. So if, for example, if you're on the basic plan and you have the flu and you want to go see your doctor rather than using Teledoc, you would pay for that office visit. The Advantage Plan, the third column over, again, the Advantage Plan covers all your preventive care items 100%, but then has the co-payment structure for any ongoing care and also prescription drug coverage. And you see it starts at $144.59 and goes up from there. That red arrow there just indicates actually the plan I'm on, and I'll reference that again in a minute. Once you pick your Apex plan that best fits you and your family, you would pick your Sedera membership that best fits you and your family. As a reminder, there are 5 IUAs to choose from: 500, 1,000, 1,500, 2,500, and 5,000. For space reasons, we only have the 2 most common ones listed here, the $1,000 and $1,500 IUA. Those are by far the most common ones that folks choose. On the left, MO is member only, MS is member and spouse, MC is member and just the children, and MF is member of the entire family, meaning spouse and children. Sedera is then, of course, banded across the top by age for those in their 20s, 30s, 40s, 50s, and 60s. And by the way, on the United Appliance Services website, all IUAs are there and all pricing are there. But what's important to note on the IUAs and the pricing is that the higher the IUA, meaning the more you're willing to pay out of pocket. If you look at that error there, I'm on the $175.51 per month, $1,500 IUA. If I had selected the $1,000 IUA, I would be paying more because my IUA would be less. Similarly, if I had selected the $2,500 or $5,000 IUA, my monthly contribution would be less because I'm willing to pay more out of pocket if and when I have to use my membership. But here's an example, and this would be the same for everyone who made the selections I did and was also in their 40s. I'm on the Apex Advantage Plan for the reasons discussed with the ongoing care that I need. And then on the Sedera $1,500 IUA. So my monthly total is $320 per month. So I'm in Maryland, right outside DC. And so when I enrolled in 2018, it saved me about 55% on my monthly total. But also, perhaps more importantly, instead of having a $7,000 deductible, I would have to first meet with my old insurance. I now have a $1,500 IUA on a per need basis. So again, if I needed surgery tomorrow for some reason, my out-of-pocket cost would be $1,500. And my responsibility is only the first 3 needs that happen in the calendar year. And hopefully I have far fewer than that. On the United Appliance Services website, there's a wealth of information. There's all the current rate sheets, details on the Apex, as well as details on Sedera. There's a video just like this one in the top right. If you want to share it with anyone, feel free to do so. There's a great FAQ on telemedicine. If you've not used telemedicine and you're just curious about it, or also looking to use it, there's a great FAQ on telemedicine there that really explains it quite well, as well as secondary and like I mentioned, how to search the multi-plan network. A quick summary of the offering. It's currently available in 46 states. It's currently unavailable in Vermont, Washington, New York, and Illinois. Washington should be freed up soon, and then New York and Illinois, followed by Vermont. It does not need an employer sponsor, so individual employees can join and enroll, full-time, part-time, or seasonal, hourly or salaried staff. Of course, you do have to be a member of the United Appliance Services Association. But if you're an employer and you want to offer this to your staff, like many of your colleagues are doing, you can certainly do that and set up what we call a list bill. We send you a simple one-page form for your billing and demographic information. We also set up a dedicated enrollment site for you and your staff to use. And then the bills would come to you as the owner of the company, and you can, of course, offset those with a payroll deduction or whatever you choose to do. If you do not want to offer that to your staff, certainly not a problem. Like I said, only 43% of companies, small businesses, as of 2017, offered healthcare. But because you're a member of United Appliance Services, of course, your staff can enroll directly, and they would get the bills directly, and of course, be personally responsible for paying those bills. And that enrollment actually happens right on the healthcare pages for United Appliance Services, so they can actually just enroll directly right there. Oh, I'm sorry. One last thing. There is a dental option. We don't have a slide on it. The details are on the website. It sets up just like every other dental option you've ever had, where all your preventive care items are covered 100%, and then there's an annual cap on how much they will cover for root canals and caps and things of that nature. While our healthcare program will certainly save you a significant amount of money, the dental option probably will not at all. But it is a great program. They use the Aetna network, and it's certainly well used. Last slide here. If you need to reach out to us, if you would like us to talk with you personally, one-on-one, with you and your family, or like I said earlier, with you and your staff, shoot us an email, give us a call. More than happy to do it. More than happy to hold a webinar like this with your staff as well, if that's what you would like. just let us know. One last thing to keep in mind is the 18th. The 18th is our cutoff. Even though this is the open enrollment period, our program actually has rolling enrollment, so people can enroll at any time during the year. They can also leave at any time during the year. But again, the 18th is the date to keep in mind. So if you were looking to leave the program for, say, November 30th, folks would have to tell us by November 18th. For folks looking to enroll, if you enroll by November 18th, your start date is December 1st. For folks that enroll between November 19th and December 18th, their start date will be January 1st. And again, folks can enroll now, or they can enroll at any time during the year. But with that, Sarah, I'm going to throw this back to you.
Perfect.
Great.
Well, thank you very much for your time. Does anybody have any questions? I haven't seen any come through. Oh, yes. We are in Washington. How long before it is available in our state?
I tell you what, I have a call on Friday to get an update. I will let Sarah know after Friday when that might be. I don't have a date right now. I apologize, but I will let you all know.
That's fine. Okay, perfect. And just so you know, if they want this, they have to enroll in both the SADERA and the
Apex.
Apex. Okay.
Yeah. So again, Apex covers your preventive care. I think about it this way: Apex is for everything that happens outside the hospital. SADERA will help you with everything that happens inside the hospital.
Okay, perfect. Well, thank you very much, Kevin. I don't see any
Thank
other
you.
questions, and I will get with the person who just sent this one in privately and get them your information so that
Perfect.
they can touch base about Washington. Thank you, everybody.
Thanks, everyone.
Good afternoon. Yes.
Thank you, Sarah. Bye-bye.
Yep. Bye.